Hello, Dr. Childress here. Welcome to my Books from My Garage series. So, in this series, I just basically walked out to my garage and picked up some books out there that I have just because I'm a clinical psychologist and am talking about them to make a point to my professional colleagues that this is stuff you should know. And if you don't know it, that's a big problem because you're practicing beyond the boundaries of your competence. You don't know what you're doing. So now here's the thing with personality disorders. I'm an early childhood guy. I'm an ADHD guy. I'm not a personality disorder guy. So this is going to be interesting. I'm going outside of my domain to a certain degree on personality disorder pathology, but kind of not so much. We'll explore some of that in a little bit. But the first thing in personality disorder is Aaron Beck. Okay, Aaron Beck, right there. Cognitive therapy of personality disorders. Now, Aaron Beck is like one of the grand kahunas, grand gods of psychology. I would say there's a pantheon. There's like three or four. So I would put in the pantheon of penultimate personalities or people in professional psychology. Sigmund Freud, he started it all. Some foundational information coming out of him. Aaron Beck and John Bowlby. So those would be my three. I'd put Mnuchin in that as well. I'm a family systems guy, and I think Mnuchin revolutionized a lot of what we had. So it'd be those four. And I'd probably, because I'm an early childhood guy, I put Dan Stern in that as well. So I've got up to about five. But seriously, Aaron Beck here is almost single-handedly responsible for an entire school of psychotherapy, cognitive behavioral psychotherapy. He's the person on the cognitive side of cognitive behavior therapy. So cognitive therapy of personality disorders. The behavioral person is B.F. Skinner. That's the one who trained the rats, depressed levers in the rat labs. B.F. Skinner's non conditioning is called learning theory. That's the behavioral side. The cognitive side of cognitive behavioral is pretty much all Beck. He's just one of the grand people. And here he's got a book on cognitive therapy of personality disorders. Now, the prevalence estimates for narcissistic personality are about 6%. So 6% of the population is diagnosable with a narcissistic personality. About 6% is diagnosable with a borderline personality pathology. So that gives us about 10 to 15% of the population with a narcissistic or borderline personality. Now, we know the narcissist is vulnerable and will collapse in response to rejection, and the borderline will collapse in response to abandonment. Well, divorce involves both rejection and abandonment by the spousal attachment figure. Oh my goodness, we're going to see a full display of the narcissistic and borderline personalities around divorce. And so we got about 10% of the population, about 10% of divorces are going to show a narcissistic or borderline personality pathology. And so where do we see those? When we look over at divorce, where do we see the narcissistic and borderline pathology, the 10% of cases involving those? Well, the high conflict cases, of course. And so it's pretty much expectable that those high conflict divorce cases are going to involve a personality disorder. So we've kind of been approaching this backwards. We've been taking case by case of these cases and then trying to prove that the person has a narcissistic or borderline personality. We should actually do the reverse. We should actually look for or expect that there's going to be 10 to 15% of people have narcissistic or borderline, and then look for them proactively. Where are they going to show up in divorce? Well, it's going to be the high conflict divorce. So let's go in and solve this proactively, where we don't have to diagnose a person as having a personality disorder in order to solve it, because that's really hard. Once we get into that, it's going to be really hard to diagnose the parent as a personality disorder. They hide pretty well. Even Aaron Beck, okay, expert, top kahuna in psychology, expert in psychology. I have a quote from him in here where he says sometimes in their treatment clinic they will treat a borderline for like 5 years before they realize they're a borderline personality. This is a top kahuna, the top person in psychology, personalities, and he says that at their clinic they can treat a borderline and not recognize it for like 5 years. They're really good at flying under the radar before you recognize them. And so I think we should just sort of anticipate that they're going to be there in about 10 to 15% of the population. They're going to be high conflict, so I would go to high conflict and just kind of say we need to know this stuff. So Aaron Beck is certainly somebody you want to read, right? I mean, because you're dealing with personality pathology, high conflict divorce. This is the person you want to turn to. Now, in addition, in my background and my training, a big mentor, Ed Shafransky, a psychoanalytic mentor, and when I was in conversation one time with Ed Shafransky, he said that if you want to do personality disorder, if you want to know anything about personality disorders, Otto Kernberg is your guy. And so he is the foundation to personality disorders, is Otto Kernberg. And I looked around, and sure enough, he is. He was out at the Manager Clinic. He's a psychoanalyst doing psychoanalysis with the borderline and narcissist. And so the psychoanalysis is depth psychology. So he just went down and really exposed the underlying structures of, look at the title of this, Borderline Conditions and Pathological Narcissism. Oh my goodness. Are we treating narcissistic and borderline personality pathology in the high conflict divorce? Is that what's going on? And this guy has literally written the book on borderline conditions and pathological narcissism. You think this would be an important book for you to read? I think so. So you know the personality pathology. So here we got the personality pathology. Oh, but wait. So he's an analyst. He's a cognitive behavioral guy. And so that's a nice blend of the two different schools of psychotherapy, each looking at personality pathology. But then, you know who the grand kahuna of personality pathology is? Well, that's Theodore Milan. Okay, so if you think about the gold standard for assessing personality disorders, that's the Milan Multi-Axial Clinical Inventory, MCMI, and it's up to its third one, I think, right now. So MCMI 3, and that is absolutely the gold standard for assessing personality pathology. The Milan the guy's got the gold standard named after him. Okay, and look at this book. Oh my God, Dr. Childress got it in hardbound. Okay. Paperback, hardbound. So this, and look, oh my goodness, and disorders of personality, introducing a DSM-ICD spectrum from normal to abnormal. I'm telling you, if you're working personality disorder, you need to have this in your library. And now, I have not read this whole book because I don't really care at this point about the schizoid personality or the various others. He's got a masochistic one in here, melancholic personality. I'm not as interested. I'm worried about the narcissist and the borderline. So those are the pieces I read and boned up on. So you want to get this book and you'll want to do that. Now, if you're talking borderline, oh my goodness, if you're talking borderline personality, the person is Marsha Linehan on that. Marsha Linehan, Cognitive Behavioral Treatment of Borderline Personality Disorder. This dialectic behavior therapy, TBT, she has got the treatment method for borderline. Now, there's others. There's schema therapy of Jung and other stuff. But for borderline, dialectic behavior therapy is the treatment of choice. And so I've got her book on that. I've also got the skills training manual for treating borderline. Okay, so these actually come from before my time as in early childhood. Okay, that's when these come from. When I was a director of an early childhood assessment treatment clinic, I went out and learned and studied dialectic behavior therapy and the borderline personality. Now, I'm working early childhood. Why would I do borderline personality? Moms. And two reasons. One is moms. The borderline mom really messes with a kid. And so that was part of it, learning the borderline personality because of the way it affects mom. But also, the trauma creates the borderline. So early childhood trauma gives me this. That's where this comes from. There's a lot of discussion that we should change the category of borderline personality over to a trauma disorder, that we're actually pathologizing little girls who've been sexually abused, and this is actually a sex abuse trauma pathology. I haven't seen Linehan weigh in on that, but she's got some good stuff in here. If you're treating narcissistic or borderline pathology in the family, oh my goodness, you have to be familiar with her work. You have to know her work really well. And so a lot of ABPA is drawing on the foundational work that Linehan does with the borderline. Now, it's not DBT therapy because it's we're doing family context, but you should know personality, or Linehan and her work on personality pathology. So here we have Linehan and Milan, and then we have Beck and Otto Kernberg. My goodness, you're just going to have so much reading to do because you don't know anything at all. And then here, I just walked out to my garage and got these books. And you probably don't even have a single one on your bookshelf. No, I bet you don't. I bet you don't have a single one of these books on your bookshelf. Yikes. And I bet you don't have any of the attachment books on your bookshelf. Well, god darn, that's a problem. So follow me over to the next one, and now we'll really start to open things up. We're going to talk about family systems.